Good morning, everyone. I'm Jill Chadwick. I'll be your host today as Dr. Seitz is doing other hospital business this morning. We are coming to you from the Dolph Simons Jr. Family Broadcast Studio, and it's Happy Friday, which means it's Follow-Up Friday, where we're going to answer your questions that we couldn't get to during the week, and we'll take a few more that pop up today. We've got Amanda Cackler. She's Director of Quality and Safety, and she is here to help. But first, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, has our numbers. How are we looking at
Yeah, I think we should also say that Dr. Seitz is a pulmonologist. He is doing his pulmonology job right now, seeing some patients. He's not just here looking good for the health system, so he does have clinical duties as a lung doctor and a pulmonologist as well. The numbers are really good. I think we've been happy now for the past 10 days or so. We continue to have decreasing total numbers, but also decreasing acute infections, and so that's a good thing. 25 acute infections with 8 of those in the ICU, 7 of those on the ventilator. We still have 50 patients in that recovery period, so 75 total patients, which I think we're happy with. We would certainly like to see less and less, but certainly being under 100 is great, and continuing to have less and less acute infections is great. Hays continues to do better as well. I think they've reached an equilibrium for right now. 17 total patients with 7 of those in the acute infection stage and 10 in that recovery stage.
All right, that sounds good. Before we jump into our community questions, are there any reporters on the line who have questions? All right, I'm not hearing anything. Before we jump into the scripted questions, Chloe has a question this morning that I think I'd like to ask. She writes, there are places in the world treating COVID-19 patients with ivermectin as a standard of care. Are we using that here in the U.S.?
No, absolutely not. It's not standard of care. The NIH guidelines, if you look in their care guidelines for treatment, they say that they recommend against the use of ivermectin. Now, there has been an update in the What's New section of the NIH guidelines where they say they can't recommend for or against it, but it is definitely not standard of care. It's really nothing that should be used here in the United States. I would caution against other people. With pharmacodynamic studies that were originally done when some of that first data came out about ivermectin, really the doses that you would need for it to be effective were fairly toxic to, in vivo studies, meaning in actual humans. So, there are still experiments and trials going on with that. We will certainly look to keep updated on those trials and any of those results, but right now, none of the data really would support the use of that, so we don't support it and certainly don't recommend it.
And then Dale has a question. In future years, will the boosters be specific to the vaccine we originally received? Can you look in your crystal ball and tell me?
Specific, you mean the same? Or?
Yeah.
I think we anticipate now, as we've already seen these variants arising, we know that the mRNA vaccines, they can change those in about 6 weeks and ramp up production. I saw an article, one of the other companies that uses one of the non-replicating viral vectors, and I can't remember if it was AstraZeneca or J&J. We'll have to find that out. But one of those companies, it would take a prolonged time to make that change. So I don't think that we will see the same one as we are seeing now, but we know that certainly with the mRNA vaccines, they can change those in about 6 weeks. It's just a matter of ramping up the production and getting the volume enough to supply that out to the general population. But you never know. As we move forward, we understand that with influenza vaccine on a yearly basis, there are 4 different strains in that vaccine. So can there be a combination of different spike proteins in these vaccines? That is one thing that we'll wait to see. And yeah, I don't have a crystal ball, but I don't understand why they couldn't. But certainly we need to kind of work on that.
Anything to add?
No, I was going to mention the concept that he mentioned in relation to the flu vaccine and that methodology that I would imagine would be very similar for this.
Okay, we're going to rock through 10 questions that we didn't get to this week, and I'm going to keep one eye right here on the phone in case you've got a new one that we think we ought to get to today. So first question. I take anti-inflammatory medication for arthritis. Will it interfere with the COVID-19 vaccine?
Go for it.
Well, I think we have to understand what kind of anti-inflammatory medication are you talking about? What is your arthritis? So if we are just talking about NSAIDs like naproxen or ibuprofen, or another, pain reliever like Tylenol, it won't be a problem. In fact, the CDC has addressed this on their website. They're saying taking those medications post-vaccine, if you have symptoms, is not a problem. They do recommend not pre-treating in anticipation of preventing those symptoms, but I would really try to talk with your physician who is helping you get through that arthritis, that inflammatory arthritis. If it is something more than those medicines, some sort of immune modulating drug, that may have an effect. It probably won't. You're still going to be safe to get it. The vaccines probably should still mount an immune response from those vaccines, but I would certainly talk with your provider because there are a lot of details in that question which we just don't know and can be specific from one patient to another.
All right. If we don't know how effective or how long the vaccines work, what freedoms do we get from the vaccine?
So I would say right now we don't really get new freedoms. It doesn't mean that we don't have to wear masks. It doesn't mean that we shouldn't congregate in large groups. It means really that if enough of the population gets the vaccine, that we should see less severe reactions to COVID. We should see less deaths associated with it. It really doesn't mean at this point in time that we can change our behaviors that we've been undergoing for the last year.
Yeah, we would like to, and Dr. Fauci even mentioned that in one of his interviews. He would like to get back to normalcy as much as possible. They are starting to make those steps. We see changes in some of the quarantine with vaccinated persons if they're exposed to COVID, but we certainly don't know. But to Amanda's point, which I think is more important, we have the freedom to understand and believe that we will see less overwhelming of our healthcare system, less severe disease, less death of our friends and loved ones. I think that is a mental and emotional freedom. It may not be meeting in parties and like we used to do. Hopefully we will get back to that. Everybody wants to get back to that. Again, Dr. Fauci even talked about that. But we just have to kind of wait. As of right now, I believe about 1 in 10 people in the United States has received at least their first dose of vaccine. We certainly need to increase that, and especially to get that second dose, and then we'll be able to talk about doing those things that we all want to get back to.
I know that I'll share this. My husband told my sister-in-law, he didn't tell me, but he told my sister-in-law that after I got my vaccine, he felt safer. So I do think that there's a peace of mind that comes with it.
That's part of
Yeah,
it.
I think we just have to be really careful with what does that mean, because there's that tendency of feeling safer. So it gets you into that letting your guard down and getting more comfortable with folks. And well, you're vaccinated, I'm vaccinated. Maybe we don't need a mask. Maybe we can interact in an environment that we haven't been previously. So I think we just really have to be careful.
No, and I was clear, I'm not changing my behavior because I know that the vaccine doesn't mean I won't get COVID or I won't spread it.
Yeah, and we all hope and want to get to that. We just, again, don't have the crystal ball, and we will continue to collect the data and analyze the data, and hopefully we can get to doing those things.
All right, question 3. When the data reads that the single-dose J&J vaccine is overall 66% effective, does that mean it prevents infection in 66% of the people, or does it mean it prevents severe infection 66% of the time? And why is it more or less effective in different regions?
Yeah, I thought for the J&J vaccine, they were looking at different regions. I think they did have a South African arm, if I believe correctly. But really what it means is you are looking at the total number of infections, also severe infections and, critical infections or death compared in those people that did not get the vaccine compared with those who did get the vaccine. So I think we really do have to understand what does that efficacy mean. And how are they testing for the infection as well? In this case, it's really against that severe disease, that critical disease and death.
All right, here's another booster question. It's a little bit different than the first one. Will we need to get boosters for the virus variants if we've already received our first and or second dose of the vaccine?
So it sounds like it's asking, would we need a separate vaccine if we've already received the original vaccine? And I think that's something that we don't really have all of the details as to after you've had your first and second dose, when will you need your next round? And most likely, as you mentioned earlier, that formula or chemical makeup will likely look a little bit different next time versus this initial go around.
Yeah, I think it's a good question, especially if we're talking about the 2-dose vaccines initially, like with Moderna and Pfizer. many people, many experts do anticipate boosters, a yearly booster. I think we heard one of the CEOs of one of the vaccine companies anticipating that we will need boosters. So we certainly do expect that. Hopefully it will just be a one-shot booster, not a two-dose series booster. But I think we do, because we always know that the virus, and we've seen this playing out right now, the virus is probably 1 or 2 steps ahead of us. So we do need to keep on top of it. And as Dr. Fauci said, more vaccinations more rapidly is going to be the way that we decrease the amount of spread of new variants, but also these variants that we have.
All right. Are you worried about any uptick in the COVID-19 cases following the Super Bowl?
So I personally, and just from the Super Bowl itself, you saw, if you watched the Super Bowl, and I know we had some text chains going through, that there were a lot of folks in that stadium and a lot of close interactions. I imagine that there were quite a few folks that were having Super Bowl parties, and hopefully, like, if they were behaving correctly and socially distancing and wearing their masks, we shouldn't see that uptick. But I think there probably will be a little bit, just because our human nature is that we like to get together during those big games.
Yeah, I mean, I think that's the key. Not necessarily there at the stadium. We know the NFL has done a good job. We know that the Kansas City Chiefs in the NFL in Kansas City has done a good job. So that kind of plays out there at the stadium as well. But I think more to your point is around the nation and this event where people want to get together, especially with the temperatures that they were around here in the Midwest. You have to probably get it together indoors. So you are having people get together indoors. We hope that there isn't. We didn't really see a large spike during that Christmas and New Year's season. So hopefully with this one event, we won't either, but we won't know that for a couple weeks, because it is that 2 to 3 infections down the line where we're able to really identify that.
Okay, regarding double masking, what is the best combination of masks to wear? Cloth plus disposable, 2 cloth masks. Should I wear filters in both masks? Show me how to tie that new knot.
Well, it sounds like we are going to see a demonstration from Dr. Hawkinson. In regards to the double masking, I don't know that there is a best combination that has been officially studied, and if there's really evidence around that. I know here in the hospital I've seen folks who might have their surgical mask on, and then they put a cloth mask over the top. But I think the key element is that it is tightly fitting around your nose and your mouth, so that there's no gaps, and that's really what's providing that source control.
Yeah, I mean, I think that with N95 masks in the healthcare setting, as Amanda is has been one of our strict people to make sure that we're doing it correctly, you need to be fitted for that, and that is a process that has to go on. People can buy N95s or KN95s at the hardware store out in the community. Is that fit good? So you do have that air exchange there where there shouldn't be in a normal N95 respirator. So that's one thing to understand. How did this all get started? I think this got started off the cuff with Dr. Fauci answering a question where he said, yeah, it makes common sense. We know that one mask with a 2 or 3 layer cloth mask can offer a barrier benefit, but also protection to the wearer. But if you doubled up, in his words, it makes common sense that would also add to that. Since that time, we have had a really good published article in MMWR, the CDC publication, about double masking. But the caveats to that were they only looked at double masking with a surgical mask and a cotton mask over that. They did not look at 2 surgical masks over each other. They did not look at 2 cotton masks over each other, and no other types of masks either. So that's the important thing to wear, to understand. So what is the best type? I don't think we know that. But again, going back to Dr. Fauci's words, it's common sense. If you have more layers, you should be able to provide a better barrier if you have the disease and don't know it, but also if you are the wearer, protection from getting it. But the more important part from that MMWR study and the new guidance from the CDC is not double masking per se, but it is the fit should be better. So you need to make that fit better. The caveats that the authors also talked about were, but it may cause you more disruption or more discomfort in breathing. So understand that. And we understand that people have different body shapes and dimensions to their face, so that could add to it as well. How do you tie a knot? Well, there are some YouTube videos out there that are very good. There is one of the more common, easy ways to tie a knot. It's kind of I maybe like to call it the hot dog bun method. So do a little bit of hand hygiene before we do this and before we put on our mask. And it doesn't take too long. It does take some practice, so we don't want to waste any masks at all, but it probably will take some practice, and it will depend, again, on your facial dimensions and the shape where you have to get the comfort there, because it will also pull on your ears as you are making it tighter. Again, the goal is to have the fit much better. So basically, you just fold your mask, kind of like a hot dog bun. You get the edges even. And then you just tie the loops into a knot. You want to get the knot as close as possible to the edge of the mask. But again, once you do it a couple times, you'll understand what is the best fit for your face. So the easiest way is to take 2 finger breaths and just tie a knot and try to get it as close to the mask as possible. As you can see there. Next step, again, 2 finger breaths. Just tying a knot, getting it closest to the mask as possible. And once you've done it a couple times, you'll understand what is most comfortable. So now that we have the 2 knots here by the mask, you start to fit it around your face. You want to fit it with the bridge of your nose and under your chin. At that point, you still have some gaps here. So at that point, you just fold it so that the gaps are reduced. And then use the ear loops and put it on. And make sure that the fit is snug.
Wow.
So this is to improve the fit of the mask. We understand that the virus, even these variants, the virus has not changed size, the droplets have not changed size. That just helps to reduce or allow the amount of droplets getting in through the gaps from your mask in your face. And again, if you want to do that, and we know that medical masks like this are available in pharmacies and grocery stores. I don't know, they haven't been vetted in the healthcare setting. Certainly ours here in the healthcare setting go through a little bit different process. But if you do that and then put a cotton mask over it, that is one of the recommendations in the new CDC guidance.
Yeah, and we've had folks in the healthcare setting actually have skin reactions to the material that are in the surgical mask. So we have seen a cloth mask with the surgical mask over the top, with that cloth mask really providing that initial barrier control, and then the surgical mask providing a couple of benefits there. And we know that it was approved PPE, and then also making sure that visible to patients, everyone was wearing a surgical mask. So we have had some instances of double masking for a variety of reasons.
All right. Did you Google that? Did you YouTube it to see how to do it? Or did you just practice?
Nope. I had to YouTube. I looked on the MMWR report, and I don't believe they really showed exactly how to do it. So there are different videos out there that you can find, and that's how I found it originally. So
and I've seen staff not completely tie it, but they just sort of twist the loops, and it can kind of tighten up those ear loops.
I think that the big concept, and we've talked about concepts here before, because a lot of this is concepts, and it's not all black and white. Really, it's to improve that fit and decrease that space around the face and the mask.
Yeah, even tucking that on the side looked helpful. You did a good job. Good job. Thank you. All right. I had a reaction to the first vaccine dose with a low fever, body aches and pains. Do I even need the second dose? Am I safe with just one shot?
I would say there's probably some efficacy to the first dose, but we know what's been published and the intention of the vaccine that's been studied is that second dose provides the optimal efficacy against the disease. So I would say yes, get your second dose.
Yeah, I would totally agree with that. The studies for Moderna and Pfizer were directed for 2-dose series. We understand that after that first dose, you probably have what you start to develop your adaptive immune response. With that second dose, you really start to rev up and boost that adaptive immune response specifically to that spike protein. So with Moderna and Pfizer, those 2 available vaccines right now, yes, you absolutely need to get your second dose.
All right. In discharging patients who had severe and prolonged illness from COVID-19, what medications do you prescribe for them at home? Do they typically go home on blood thinners, steroids, and oxygen?
Well, I think this is, if you're talking about severe and prolonged illness, they've probably been in the hospital long enough where they are not still on the steroids. The steroids are typically a fairly short course, and in severe and prolonged, those people are here for 3, 4, 5, 6 weeks or longer, so they're probably off the steroids at that point. The blood thinner, there's really no good guidance at this point on what to send home with. If we have people with mild illness, they will be sent home for short periods of time. By the time they're in that prolonged, they may be done with the anticoagulation part of that. Really, they don't get sent home with anything else. If they are having, aches and pains, they can certainly take Tylenol or other NSAIDs like ibuprofen or naproxen. Those are really the specific medications.
Yeah, and then also obviously whatever their underlying medical illness
Yeah.
is, going home on their normal therapy as well.
How have vaccine reactions been among people with autoimmune diseases? We get this question a lot.
Yeah. Well, I'm not aware of any specific problems with autoimmune diseases in the vaccine. I don't think that there's any real difference in the reactions in patients with autoimmune disease or patients without who get the vaccine. So I really don't think that's a big issue. There's certainly no evidence. In those trials, there was no evidence of that. With autoimmune disease, depending on what immunosuppression you are on and who is leading your medical care, talk with them. It will be absolutely safe to get the vaccine. We just got to make sure that we believe that it will cause an immune reaction that gives you protection.
And I was going to say, I don't think I've seen anything
No.
that studied various patient populations and their reactions with the vaccine.
All right. And this is question 10, and that means we have time to get to some of these that are coming in today, which are really good. So hang tight. What will the impact of the new virus variant be on the spread of infection in our region? Have you seen any noticeable data that changes that concern you? And how do we protect ourselves against these mutations?
So I think what stands out right now is, as Dana presents every morning, our numbers going down. It is suggesting that we have had a change in our social behaviors, which is a good thing. I don't think that's concerning. As Dana alluded to earlier, we also don't see anything suggesting that the dynamic of transmission is different in regards to the size of the droplets. We know that the respiratory protection measures that we've put into place should be the same mitigation strategies going forward with the new variants. So again, I don't think that's concerning. I think it's just suggesting that we need to continue good masking behaviors, get your vaccine whenever you get that call that you're ready to get it, reducing the likelihood of being exposed to someone with COVID by staying in your bubble, good hand hygiene, not going around folks when you're ill.
Yeah, no, I would agree. I think, in Florida, I heard the other day that the variant, the UK variant, B117, was maybe up to about 5% of variants that they had identified. But up through early January, from November to about early January, I think they have only identified it like 0.4 or 0.6%. So it has increased there. We know that the variant has been identified in Kansas. I haven't seen any information or data that shows an uptick or a surge where it was identified. And again, in our rolling 7-day average here for the Kansas City area, we haven't seen uptick. We've seen those numbers decreasing as well. So we are always on the lookout. We know that the state of Kansas is ramping up their genome sequencing. So we will continue to be on top of that and, hopefully get some more guidance from Dr. Norman as well. He's always a good source for that.
All right, here we go with the bonus round.
All right.
All right. Debbie says, I had the Pfizer vaccination 2 weeks ago with no side effects at all, not even a sore arm.
Yeah.
Please tell me the vaccine is working.
Yeah, I think you're lucky that you didn't get
for you.
laid out in bed for 24 hours. I don't think there is no correlate of protection depending on what kind of reaction you get after the vaccine. So based on these studies and showing how those infections changed and the amount of people who got infected after they got the vaccine and the amount of people who got it after the placebo, even though you didn't have a reaction, we would still say that you are protected.
Yeah, and make sure you get that second one.
Yeah.
Yeah. Sean wants to know, why does the questionnaire before getting vaccinated ask you, are you allergic to latex? Amanda?
I don't know, does it have, it's a pretty generic question
Yeah,
that we
it's
ask with all
generic.
vaccines, but I don't know if there's anything actually within this vaccine that has a,
Yeah.
Is it because of the gloves?
Well, our gloves, in most healthcare settings, the gloves used are latex-free due to the amount of folks that have had allergies to latex in the past. So I don't actually know the significance of asking that question.
I think
with
it's
this
probably
vaccine.
just a generic question. You know, there may be an egg allergy question on there too, but people with egg allergies are absolutely 100% able to get this vaccine as well. So this may be just a generic question on a vaccine form.
All right, and Vicki wants to know, any new data out there on estimates on how long we think the vaccine will last? She said that she read an article, she doesn't cite what it is, that it's not lasting as long as in the older, more vulnerable patient populations. Have you read anything on
You know,
that?
I don't think we know. We certainly hoped and believed that this vaccine, the reaction after it, the B cell, the memory cells that create the antibodies, the T cell responses, all of those things will be long-lived, lasting, you know, at least a year. So I don't think we know. Those are certainly ongoing, and those are things that are going to be continued to be evaluated after this vaccine rollout. There continues to be data gathering. But I think overall we are hoping, because of that robust immune response that we saw in those early studies, that this memory response and the immunity to prevent severe illness and death will last, you know, at least a year. But we do anticipate at some point some kind of booster. We just don't know how that will really look.
Do you think it's a respiratory virus, so do you think it's going to follow the same path as the flu virus in regards to coronavirus season being October through March, similar to flu season?
I believe right now, as we have seen this past year, it's going to be just with us right now.
Always.
Continually,
always
persistently.
Season.
Yeah.
COVID season is all year long.
Yeah.
Oh, wow. All right, so Shelley said she had a friend that had COVID at the end of December. He was fairly sick for about a month. Last week, he received his first vaccine, which hit him hard. He felt like he had COVID all over again. Why do you think that is? Is it common? And will his second dose be even worse?
Yeah. You know, I can't speak to the second dose itself. We just don't know. I've had friends who got the first dose, and it was pretty hard on them. They had COVID-19, but then got the second dose, and they were totally fine. So I think it's just an individual thing. You know, we don't understand why. Is it because you do already have some immunity gained from that spike protein that you saw with the coronavirus infection itself, and now you've had this somewhat of a booster? That could be, you know, owing to that increased reaction after that first dose. But absolutely 100%, you still need to get that second dose. And you don't know, maybe the second dose, it will be less of an effect. Maybe in that second dose, it'll be about the same. So we just don't know that. And again, I think a lot of it boils down to the individual.
And the question about, is it common, everyone that I've talked to who has had, and they haven't received their second vaccine yet, but their first vaccine, and they also did have COVID, they do seem to have a little bit more strong of a response, taking them out. But I also know many who didn't have COVID, and it's also taking them out for the next day due to myalgias or chills and that sort of thing. But I also know quite a few folks who haven't had anything other than the sore arm. So it just is very variable.
All right, Isaac says he wants to know what you think about a study out of Israel which suggests that the Pfizer vaccine cuts transmission. Are you aware of that study?
You know, we knew that with the media reports that Israel seemed to be doing a really good job of vaccine rollout and being able to vaccinate a lot of their population. So they are an early leader in some of this information. I did see a little bit about that. You know, we hope that's true, but I haven't seen the study itself, just the news reports. And that would be good. You know, we definitely hope that if you have a good immune response, which again, these vaccines do look like they create a good response, you have less replication overall compared to if you didn't have the vaccine, less replication of the virus in your upper respiratory tract. So therefore, if you have less virus, you are less apt to spread it as well. But, you know, those are some of the questions that we definitely want answered, and I think we will get answers to those. It's just going to be a little bit, because the vaccines still are fairly new. And again, the amount of population in the United States that have been vaccinated is pretty low, but we have seen great improvements with our healthcare workers here at our health system who have been vaccinated. Our amount of healthcare workers that have been out for quarantine or illness is certainly down. We hope that does play a role in decreasing transmission.
Sherry says that she and her sisters have all had both doses of the vaccine. She lives here. Sisters live in Colorado. She wants to go, wants to know, is it safe, and can they take their masks off when they're around each other indoors?
My advice doesn't change whether
Yeah.
you have had the vaccine or not. You're interacting with folks who you are outside of your household. So there's a risk associated with that, and we know there's a risk associated with that. Is there potentially less, as you just mentioned, is there a less likelihood of you having that transmission? We like to think so, but again, we don't know that for sure. So is it safe? We don't know. We
Yeah.
know that the social distancing and masking have been effective. So I think you really have to evaluate, is the benefit of getting together worth the risk of potentially getting the virus, understanding that you just might not have as severe a reaction because you and your family have
Yeah.
been vaccinated.
And we certainly want that, grandparents want to see their grandkids, all that. I would agree. I think the risk is less, but we don't know that. And so that's why the guidance hasn't changed. But if you are doing that, just understand that there is risk there, and you can still mitigate that as much as possible, and you should. But we hope that it is less, so that you can get together in those circumstances.
Glenn says he has a couple of friends that have recently recovered from COVID, but they're still feeling unusually fatigued. And he wants to know if you have any recommendations in terms of supplements or medications that might help them. I know after the shot, and I was feeling really tired, that you and a bunch of other people told me to drink a lot of water, and it does help with the shot. But what about these people that are long haulers and they're feeling tired?
Yeah, I mean, this goes to the long hauler symptoms that we know about. The most common ones are probably cough or shortness of breath, fatigue, malaise, which is just not feeling good, and probably brain fog. Those are the most common. I would certainly try to talk with your primary care provider. There's not a lot to do, but take it one day at a time. Start to do activity. If you can increase that activity as much as possible. If you need to get in to see your primary care physician, do that. If you're having brain fog, you may want referral to a neurologist. If you're having the shortness of breath, referral to a pulmonologist for evaluation. Start there. We have the post-COVID clinic, and we are doing that for our patients currently here at the health system. We haven't started external referrals, but we will be. We do anticipate that. We just want to make sure we get all of our systems and processes in place so that we can most efficiently expedite the patients to where they need to go. Are there supplements? You're certainly welcome to always take vitamins in the directed doses that you find on the bottle. I don't know that they'll help too much, but certainly you can take those just in natural good health. But otherwise, I think it's really a matter of going one day at a time, trying to increase your activity as much as you can on that day. And if you look back in a week or two and you're doing more, that's a good thing. But we know that these symptoms can last for some time. It can be a few weeks to 3 or 4 or 5 months. But it is just, a one day at a time thing, one step at a time.
Yeah, I think that knowing that it can last so long is also another reason that it separates it from, like what we've said before, it separates it from the flu, but it also is one of those elements of we want to prevent it as much as possible because everyone's going to respond a little bit differently.
Yeah, we know that even, world-class athletes, Paul Pogba out of France and Manchester United, the soccer player, he had very mild disease, young, healthy, world-class athlete. And he had fatigue for 2 or 3 months even after that. So it does happen to everybody. We don't know who it will happen to, but on an individual basis, you're certainly at risk for that.
All right, Josh wants to know for the bearded among us, how does facial hair impact mask effectiveness?
Well, I will say beards in the healthcare setting do prohibit you from having a well-fitted N95 mask. So that is something, whenever we talk about fit testing for those respirators, you're not allowed to have a beard. If you, once you get your fit test, and even 5 pounds weight gain or weight loss can impact a tightly fitting respirator. So it is a challenge, and something to consider is having the beard more important to you than having that really nice fit. I think you demonstrated earlier that there are some things that you can do to manipulate the mask to get it to fit a little bit tighter, but I think it's a serious consideration.
Yeah, I mean, even walking in here today in our own health care system, I did see a gentleman with a beard, and it was basically, the mask was here. So it does affect, and it will affect you individually. And it could potentially affect other people if you are not providing an adequate barrier. So I think that is one thing you definitely need to consider.
All right. 2 or 3 more questions, and then I'm going to let you guys go on a Friday. So Kathy wants to know, is the Pfizer vaccine effective for someone with CLL?
CLL is a lymphoma.
Okay.
Yeah, as far as we know, it should be. Again, talk with your medical provider, your hematologist. You would be one of those patients that we would like for you to get it to reduce your risk, because we know that patients with hematologic malignancies and cancer have a higher risk of worse outcomes. So certainly talk with your provider. We hope it's efficacious. If you've gotten other vaccines, you should still be able to get with this one, even though is it safe or not safe? Sometimes we just don't know those answers to those questions, and so the answer is give the vaccine, because there is probably potential benefit there. So,
Okay, here's something from Nadine. She said that she got her first shot on February 3rd and her arm got sore. And then more than a week later, she gets a rash and it's itching.
Yeah.
She said, is that a delayed reaction?
yeah, I think I've just saw some new articles that there are evidence of those delayed reactions. So they do happen, they do occur. I can't remember if it's one with one vaccine versus the other, but we know those do occur. There's now some more published data about that. Again, I would say still nothing to worry about, but yes, those reactions can occur.
And continue to proceed with getting that second dose.
Yeah, absolutely.
All right, 2 more questions.
It is not a contraindication, and also I think some of the guidance from the CDC is you can also elect, if you get a local reaction where the shot was actually given, you can actually get it in the other arm, the second dose.
Oh, good. Don't have to do it in the same place. All right. So Anil,
Yeah.
hi Anil. By the way,
Superstar.
Yes, he is. And he was on a news program last night on Fox KC. They interviewed him. And I have to say that I thought personally he was starting to look good. Not a doctor, but it made my heart feel good that his face and even his voice seemed a little brighter. So, but he has a question. He wants to know, are we seeing a blood sugar spike with diabetics after they get the vaccine?
I would have to ask my endocrinology colleagues. I don't know if that's been studying and looking at blood glucose levels after vaccine. We certainly know that with the disease itself, people will have abnormalities and derangements in their blood glucose levels, hyperglycemia and hypoglycemia as well. So a lot of our endocrinology colleagues see a lot of the COVID patients because of that. But post-vaccine, I don't have a good answer.
And I don't remember seeing where they were showing all of this common signs and symptoms post-vaccination. I don't remember seeing anything about a severe diabetic.
But I've heard people talk about symptoms related to what they thought maybe was a hyperglycemic episode. So, that could be. But I don't know that we have the raw data for that.
All right, so, and Joellen gets the last question. She says, after receiving my first dose of vaccine, the provider gave me info on registering with a site called vSafe, run by the CDC, and you can send symptoms daily. What do you think about that? And should people do it?
I think it's a great idea. That's the way that we're able to collect the information and learn more about the side effects of the population as more and more folks get vaccinated. Everyone is offered that option to participate, and so I think it's absolutely a good way to help inform the nation and those that are studying the vaccine and their side effects.
Yeah, absolutely. We have the long-standing vaccine adverse events reporting system, or VAERS. That has been long-standing. That's for all the vaccines. The vSafe is something new with the CDC for the COVID vaccines. They have had a lot of people who have downloaded and put in their information. That's actually one more thing you can do. And I believe you will get either text messages or even a call from people on the other side of that line. So that will help you through the vaccination process, post-vaccination process as well.
All right, so Monday, we invite you to join us when we explain a little-known side effect that some breast cancer patients especially those with a new diagnosis, may experience from the COVID-19 vaccine. Dr. Jamie Wagner, Chief Division of Breast Surgical Oncology, and Dr. Annalisa Winblad, Division Director of Breast Imaging, Department of Radiology, are going to join to help us better understand the side effect and what you need to tell your doctor. And I've been told that it comes down to, it may make a difference where you ask them to give you your shot. That's on Monday. It's interesting. It's the way that I understand it, it's not something to be overly concerned about, but it is important information, and we want to make sure that you have it and you understand it. So we will see you on Monday for that. Final thoughts, Dr. Hawkinson?
It's going to be cold this weekend. Everybody stay inside. Everybody don't mix your bubbles. Let's hope we don't see this surge post Super Bowl, and stay healthy. Hopefully your number will be called for the vaccine, and when you are able to get it, take your shot.
He stole what I was going to say. I think the high is supposed to be 1 degree on both Saturday and Sunday, so very much stay warm, stay indoors if you can, hopefully with your bubble.
Yeah, good day to read a book, I think. Stay in if you can. All right, we just appreciate you so much. We really do. We appreciate you showing up every day and asking the thoughtful questions that you do. And as we close today, Dr. Stites and Nurse Jennifer get our final words. Jennifer has been working our testing tent for months. She and Dr. Stites share reasons to get your vaccine when you get the chance. Dr. Stites is back on Monday. Everyone, take care. Stay safe. We'll see you on Monday.
Why did I take the vaccine? I took it for my family, for my friends, and for every single patient who has come through this swab line.
This is incredibly important. This is how we win the game. This is how we win a pandemic. Take your call to arms, don't throw away your shot, and begin to help us beat coronavirus.
I'm Cliff, and I'm from Overland Park, and I got this shot for my family, friends, and coworkers.